Please welcome to the stage Jenny Bogard.
Good morning. I hope nobody minds that even though I live in California, the Floridian me, I see Florida people over there, is freezing, so I'm going to keep my scarf on. So before I get started, what I'd like to do is a little exercise. And don't worry, I'm not going to make anybody do jumping jacks. But it helps me to understand who my audience is. So this applies to you, I just ask that you stand up. So stand up if you've heard of the Alliance for Healthier Generation before today. Okay, good, you can sit down. Stand up if you represent a school or school district. Okay, sit down. If you are a healthcare provider or work in a healthcare setting. Okay. If you represent a community organization that's working to reduce childhood obesity. Great, very diverse group today. It's great. Sit down. Stand up if you're a parent. Okay. Sit down. Stand up if someone close to you is affected by obesity. Okay, sit down. I just wanted you all to see how many that this actually affects, how many of us are affected by obesity. And finally, stand up if you feel like you can make a difference in someone's life. Everybody should be standing up at this point. You can sit down. So the fact that you are here today actually does show that you actually can make a difference in someone's life. Okay, so let's get started. My talk today is really going to be about my organization, all the initiatives that we have at the organization. But before I get started, I just want to commend Mayor Pulowski, I don't know if he's still here, in the city of Allentown for all the wonderful programs that they've really brought to life there and how, even given the limited resources that they have in the city. I'm hitting the green button. I'm not sure. There we go. Okay, so the mission of the Alliance is to reduce the nationwide prevalence of childhood obesity, but more importantly, it really is to empower kids to make healthier lifestyles. Our big, hairy, audacious goal, for those of you who know what BHAG is really to eliminate childhood obesity within a generation. And we really are striving to do that. And our hedgehog around that is really to activate others, so other organizations, people, individuals, families, and youth to make that change. The Highmark Foundation mentioned in their agenda the Institute of Medicine strategies to preventing obesity. And what I really hope that through my talk and over the next hour that I can show you what the Alliance has done that really hits upon these focus points from the catalyst that the IOM has mentioned. So what I wanted to start off today is really talk about the Alliance values and principles. And the reason why is I really wanted to show you why we partner with the people that we partner with, and also how we're able to implement the programs that we design, but also to encourage all of you as you sit there and think about, what are your department or your school or your healthcare setting, what are your values and principles in eliminating and fighting childhood obesity? So we really believe that there's a place for everyone at the table. And what does that mean? Well, as a nonprofit, public health-oriented organization, we will work with anybody. That means health insurers, that means food and beverage companies, that means unlikely partners. We really believe that everybody has a seat at the table and everybody has something that they can contribute. However, we make the very clear distinction that we won't take any financial contributions from key organizations like insurers and food and beverage companies. But we still will work with them and help them change their business practices, and I'll go over that in a second. The other thing that we really look at, or one of the values that we have, is we really look at this micro and macro level strategy. And what does that mean? So we, on a national level, we've created industry agreements to really change policy, change social settings. But we also really focus on the micro level. So we look at individual schools. We work with families. We work at healthcare provider offices. And we really feel like the confluence of the micro and macro level strategy will create that perfect storm to help us reduce childhood obesity. Really, and we really actually believe this. Our end goal is to put ourselves out of business. I mean, we really do want to see childhood obesity eliminated. And as I said, our big, hairy, audacious goal is, within a generation. And the wonderful 120 people that I work with across the country really come to work every day energized and passionate, and they really feel this day in and day out. We want to see childhood obesity eliminated. And finally, societal norms are changed by people, not organizations. We really are only as strong as the people that we inspire to change. So really the Alliance story is the story of all individual schools that we work with, is the story of the youth advisory board members, is the story of a provider setting, and how they were able to create the change within their own communities. So why take action? Well, this group knows firsthand, childhood obesity, 1 in 3 kids are overweight or obese. The latest stats that I have is 39% of children in Pennsylvania are overweight or obese. We know that. Some experts even believe that if we don't decrease childhood obesity, this generation may live not as long as their parents lived or will live. So the cost of obesity, why talk about the cost? Well, we know that for children, it's about $14.1 billion. We know that healthcare expenses are 3 times higher for an obese child than an average age insured child. What's even more startling to me is that some studies show that 80% of children between the ages of 10 and 15 will be obese adults by the age of 25. And what does that mean? Well, as an employer, a lot of employers are struggling right now with healthcare costs, and that's our future generation. That's your future workforce. So if we can't get a handle on childhood obesity, these overweight and obese children are going to be your obese employees. And we really need to think about that long-term strategy of how we want to really tackle this, and really give the tools and resources that are needed to these kids so that they can become healthy adults and be productive adults. So talking about adults, we know what adult obesity costs the healthcare system. On average, it's $147 billion. Different studies range from $1,800 to over $2,700 per year for obesity-related healthcare expenses. Loss of productivity for obese workers, are $153 billion a year. There's about 450 million days of work that are missed a year due to obesity. In addition, parents who actually have a child in poor health, don't perform as well as parents with healthy children. And then a Cornell study back in early January of 2012 also shows that insurance companies are actually spending more money than what was initially thought to treat obesity-related conditions. So if you're looking at a macro level, obesity studies range from $190 to $209 billion a year. We know that obesity costs 21% of healthcare costs. Right now, talking about wellness programs, there's a lot of focus on what we can do in terms of employee wellness models with the Affordable Care Act and the final rules being implemented around wellness. I encourage all of you to think outside the box and, what if we expanded traditional employee wellness models to include families and kids? That's really the future, is to really engage the entire family, because those employees and their dependents, it really is going to make a difference if we can get the children involved, get the dependents involved as well. What's interesting on the left box is that if we decrease obesity by just 5%, which is actually an attainable goal, we could save almost $30 billion in 5 years. But we could save $611 billion in 20 years. So think about that, 5% decrease. That's a significant savings for the healthcare system. And we know that there is an ROI on wellness programs. So every dollar spent in wellness programs, we're seeing over $3 saved in medical costs and over $2.50 saved in absenteeism costs. So what is the Alliance? So we were founded in 2005 by the American Heart Association and the Clinton Foundation. And the story goes, which is a true story, when President Clinton had his first heart surgery, he was recovering in the hospital, and he received thousands of letters from families across the country who were dealing with the same congestive heart or chronic health conditions that he was dealing with. And he really started to reflect on what he could do given the position that he was in. And being a father of a daughter, he really wanted to focus on the younger generation and youth and really think about how he can impact youth so that they can have the tools and resources to have healthier habits and lead healthier lives. Around the same time, the American Heart Association was thinking about expanding their mission to include information and programs to address childhood obesity so that children, again, could become healthy adults. So the two organizations collaborated and created the Alliance for Healthier Generation. And we work with industry leaders, we work with healthcare providers, we work with families, we work with schools, and we work with youth. We have since incorporated and are our own entity now, but we still work very closely with the Clinton Foundation and the American Heart Association. They still provide a lot of strategic guidance for the direction of our organization. So what's our reach and impact? So we currently have over 2.7 million children who are in the Healthier Generation Benefit Network. We have 56,000 healthcare providers that can get reimbursed for preventative services around childhood obesity. We work in over 18,000 schools across the country. We have 155 out-of-school time organizations where we're piloting a program. And we work with over 100 of food and beverage companies to help them offer healthier options to schools across the country. So the Healthy Schools program, which is by far our biggest program at the Alliance, we're primarily funded by the Robert Wood Johnson Foundation. As Dr. Dietz had mentioned, schools are a key point of contact for children. I don't know if most know this, but more than 20% of the U.S. population spend their days in schools and consume 50% of their daily calories on campus. So think about that. More than 20% of everyone in the country has 50% of their calories at the school. We know healthy students perform better. We know that they're happier. Some studies even suggest there's better math scores for healthier kids. So we need to really encourage physical activity and healthy habits while they're at school. The Healthy Schools program was created by a national panel of experts. We actually call it the framework. These guidelines provide a roadmap to creating a healthier school environment. There are 7 key wellness areas that the framework provides content on. So employee wellness is one of them, physical activity, increasing healthier option foods is another one. Schools, any school in the country can participate. It's absolutely free to participate in our program. We do ask that the schools actually make the commitment. They have to be committed to making that change and have to strive to reaching some of the wellness areas in the framework. Every school has on-demand training. We have Healthy School program managers that are actually physically located across the country in almost all 50 states that work individually with every school to help them achieve their goals for that year. Every year, we give national recognition to schools who meet a certain level of that wellness framework. It's bronze, silver, and gold. We invite the wellness lead and the school principal to a forum every year in Arkansas. In fact, the Healthy Schools Forum this year will be next weekend. And it's a really fun weekend where we recognize all the schools who have really made the change and President Clinton has been known to make an appearance there, so everyone's excited about that as well. We also offer biweekly Healthy School Program newsletters that offer support, and we also highlight case studies so that other schools who may be struggling in certain areas can get inspiration in their own communities on how to really implement change. So what have we done with the Healthy Schools program? Well, some of the evidence, because we collect data at the Alliance, data is very important to us, is showing that 80% of our schools have made measurable progress. 85% of our schools even meet or exceed the beverage guidelines. So I'll talk a little bit about that when I talk about our competitive foods agreement. But what I wanted to do right now is kind of talk about, on a local level, some case studies to kind of give you some ideas of what schools in your state have been doing. So Wilson Middle School, I'm not sure if anyone is familiar with this school, but it's located in South Central Pennsylvania. They signed up in 2011, so they're in their third year with a Healthy Schools program. And the chair of the Wellness Council was having attendance issues with her staff monthly meetings after school. And she really wanted to think of a fun and engaging way to get the staff involved and really get their buy-in. And I'll say that a lot throughout my presentation because I think it's important that you get buy-in both from a staff level but also from a youth level as well. I mean, hearing the youth voice is extremely important, and we firmly believe that at the Alliance. So what this wellness lead actually did is she sent out an agenda to the staff at Wilson Middle School. And she said, come to the meeting, and it's going to be a standing room only meeting. And what she did is she removed all the chairs from the room and got 8 stability balls that she borrowed from the PE teacher. And they bounced on the balls and rolled around during the meeting. And actually, the staff really enjoyed it. And her attendance went through the roof for the next month because the staff was working out, they were having fun, they were laughing about it, but they're also getting things done. So this is just one example of what you can do with no cost whatsoever. I mean, she borrowed the balls from the PE teacher. I will tell you that this school is also moving towards a bronze level status. They are in the process of trying to eliminate some of their unhealthy beverages. Right now they are struggling, I will be honest with you, with trying to remove lemonade and iced tea in this school. They did this whole Rethink Your Drink campaign where they piloted removing it. They're in the progress of making that more permanent. And once they do that, they will be able to achieve bronze status. So we wish them luck. The next case study I wanted to talk about is at Berry School, which is a school in Philadelphia. Berry School is one of our transitional schools, so they've actually successfully completed the Healthy Schools program. What the student government did there, and this is another idea of try to engage your students if you're from a school, the student government really wanted to plant a garden. And they wanted to plant produce that they could put on pizza. Now, obviously, being a school, they had no money to do this. So they actually went out, the student government had this idea. They went out and invited neighbors, so the people and the organizations that were directly around this school, and asked them for their financial contribution, but also their support. And they were able to do that, and they were able to plant the garden. They also invited kids outside of the student government who expressed an interest in nutrition and cooking to really get involved. And they also installed a camera that videotaped the produce growing throughout the year, so they could show that at the end of the year. And they had a rooftop garden party at the end of the school year. So again, another example of getting community members involved, reaching outside of your local resources to really engage people. And finally, my last example is at Delaware Valley Elementary School. And this is also a transition school, which means, again, that they successfully completed the Healthy Schools program. This staff member, the wellness lead, really wanted to implement a program during the school day outside of instead of having her employees come before or after school, because she knew that attendance would be very low if she did that. So she really tried to think creatively of how can I engage my employees, so really get them behind the Healthy Schools program and get them interested in, increasing physical activity throughout the day, not only for their students, but for the staff as well. So she actually bought 8 pedometers, again, low cost, and created 18 teams in the school. And those 18 teams had a pedometer challenge, and it was a relay challenge. So each person on those teams had the pedometer for a week and then gave it to another person on the team the following week. And every week they were asked to increase their steps by 500. And they also were asked to eliminate caffeine and unhealthy beverages. And what she found is that the staff absolutely loved this. It was team building effort. It engaged them. It increased their physical activity. It cost hardly anything to implement. They were completely excited to get the Healthy Schools program up and running. And in fact, one of the team that won, every team that was able to reach that goal, their name was put in a drawing, and the team that won for free lunch actually donated their free lunch to a family in need at this school. So it was a great program, and they were really excited about that. So with that, I'm going to shift focus, but I wanted to show you a video, and please keep in mind that we just recently went through a rebrand. So the video is from our old logo and actually our former CEO. But I thought it was interesting to kind of show you firsthand of kind of the things that some schools are doing. And this is a school in New York City.
This morning on Today's Health, the fight against childhood obesity. Former President Bill Clinton is working with 13,000 schools across the country to provide healthier food choices to millions of kids. Here's NBC's chief medical editor, Dr. Nancy Snyder.
I would sit home and I would eat probably something that I shouldn't be eating when all I wanted was burgers and fries. I would go home and just kind of sit on the couch and kind of meld into it.
A common problem for nearly 25 million children in this nation who are overweight or obese.
Take your milk.
But today, a war is being waged on the front lines, and students like Meliana Cisak are getting support at school, ultimately choosing healthier foods and opting for exercise.
The one thing I notice you guys don't have, I don't see a fryer anywhere.
Oh no. This is what a kitchen looks like in school. There are not fryers. And now we've increased our vegetable consumption by about 30% over what we had in the beginning.
The driving force behind this?
Hi.
Former President Bill Clinton.
How are you?
Clinton's emergency heart surgery several years ago forced him to change stubborn habits, a realization he hopes will motivate others, especially the young.
Why do you see this investment in these kids so important?
Children need enough food, the right kind of food, to grow and to develop their bodies and their brains. When I had all these heart problems, I realized that all this was totally unexamined.
A multifaceted approach combining healthy food and exercise is the key to Clinton's initiative.
You will see people come into the cafeteria and complain if there aren't oranges.
Number 1.
And here at PS2 Elementary in West New York, New Jersey, students participate in activities ranging from scheduled class breaks to an indoor fitness trail. Even teachers get moving, attending physical fitness boot camps. The integrated philosophy is catching on.
9, 10.
Kids spend 6 to 8 hours a day in school, so they want school to really emulate the environment that they want to produce at home.
This is in the DNA of the school district now.
They're having fun.
Yeah, they are. They're into it.
For today, Dr. Nancy Snyderman, NBC News, West New York, New Jersey.
So again, that video is a little old. That was taken last year. But again, this is just one school that was able to incorporate physical activity throughout the day. It doesn't necessarily have to be a PE class or a dedicated time, but teachers were able to think creatively and outside the box on how they can get their kids moving. So again, shifting gears a little bit, I'm going to talk about our healthy out of school time framework. So what we did is we took the evidence-based model from the Healthy Schools program, and we really started thinking about, okay, how can we create this healthy environment throughout the day as the kids wake up to the time the kids go to sleep? We really wanted to support and encourage kids to continue these healthy habits. So we turned to healthy out-of-school times organizations, and why focus on healthy out of schools? So 15% of kids, that's a little bit over 8 million kids, actually go to an after-school organization. This is a non-academic environment, so you can really think more creatively and give positive youth development approaches. There's snacks and meals that are served, so there's an opportunity there, and a lot more physical activity opportunities as well with these organizations. And again, think of the YMCAs, the Boy and Girls Club, JCCs, other faith-based organizations where these kids are going. So I wanted to tell you, now this again is in a pilot stage, so there's 155 sites across the country that we're piloting this, collecting data to determine the impact that these types of programs have. What I wanted to talk about is 2 examples, and I actually don't have an example in Pennsylvania, but one that's close to Pennsylvania is Washington, D.C. So 73% of D.C. public school district students are eligible for free and reduced school meals. And 92% of those students are minority. So the Suitland Community Center, what they wanted to do is offer healthier food options, but they didn't want to just throw healthy foods out there and without actually engaging the kids. So what they did is they did a Suitland Chat and Chew for youth, but also their parents, where they used the Alliance Healthy School Guidelines for foods, and they brought these foods in and they did a blind taste test. So they blindfolded all the parents and the kids, and they had the kids and the parents determine what snacks and foods tasted the best. And out of those snacks and foods that were rated the highest, they then implemented it. So this is another great, fun, engaging way to get the parents in the community behind your changes, as well as the kids excited about it because they were part of the process. Another example is in Los Angeles. In Huntington Park, unfortunately, 53% of children are overweight or obese. 89% of LA Unified School District students are minority. And 61% of them are eligible for free and reduced price lunches. And what they did is that they wanted to get the Latino network involved, given that it's a big Latino community. So they provided workshops where parents actually were able to come and receive educational resources and take classes on healthy cooking, and given some of the tools and resources to really start making the changes at home. So again, getting the families involved, getting them behind your program, getting them excited about it, to support it, is key in these success stories. Another initiative we have at the Alliance, thinking about the IOM's Marketing What Matters Catalyst, is getting adults engaged. We work with a lot of employers across the country through the Healthier Generation benefit. And, we thought, how can we get adults excited and raise awareness in the communities about this? So we created Team Healthier Generation. And Team Healthier Generation is a fundraising event, but more importantly, it's really to get the communities behind us, support behind us, as well as raising awareness. So we have spots in very high level, or we have spots in very big marathons and half marathons. In New York City Marathon coming up in November is one of them. We have a actual staff who is a certified trainer who trains personally each of the people who are part of Team Healthier Generation. But we also encourage other people to find a local event, whether it's a 5K or a 10K or a walking event, to create their own events in their own communities and create their teams around Team Healthier Generation. So that's just another example of what we do to raise awareness of childhood obesity. The industry team, which is actually the team that I work on, is the team where we work with food and beverage companies and insurance companies, as well as employers, and we create industry agreements to help businesses change their practices. And one of the things that we were able to do is we worked initially with the beverage companies and bottlers, which is very confusing for those of you who are in the food sector of school districts and schools. It's there's so many moving parts. But anyway, we worked with the beverage companies and the bottlers to get them to offer less low-calorie or zero-calorie beverages across the country, irrespective of the school's participation in the Healthy Schools program. And what that resulted in was a 90% reduction in beverage calories shipped to all schools across the country. We also work with food manufacturers and distributors. We have a product navigator on our website that is compliant with the USDA's guidelines that they just released. So if a school food service director is interested in offering healthier option foods but doesn't know where to start that process or look to start that process, they can go to our website and look at our product navigator. So for instance, if you were looking for wheat bread and needed to know what wheat bread is under compliant with the USDA guidelines, you could go to our website, and all of the brands that fit under those guidelines are on that website. So we like to streamline the process for you. And what these agreements did with these food manufacturers is really allow schools to easily identify healthier products and ingredients through our website. It also allows school districts to save money because we have gotten the manufacturers to participate in group purchasing organizations, so GPOs. We also were able to simplify the bidding process for food service directors. Again, they can just go to our website and look at all the all the products on our navigator. These are the companies that have currently committed to the Alliance. We are still working to increase our reach when it comes to working with food companies. But obviously with the USDA guidelines just recently announced, there's a lot more interest in companies trying to have their products meet our guidelines since they align with the USDA's guidelines. So again, that's our work with food and beverage companies. A lot more is happening in that space now. We're very excited that people are now starting to pay more interest in that. Shifting gears again is looking at the healthcare side, and this is actually the program that I lead at the Alliance, the Healthier Generation Benefit. So historically speaking, healthcare providers were not always getting reimbursed for preventative services around childhood obesity if there wasn't a comorbidity there. So what we did is we were able to get health insurers, and Highmark was actually one of the initial health insurers to participate. We were able to get health insurers to commit to offering preventative services. We know that overweight children and teens are likely to develop serious health problems. What we're able to do is get insurers and employers who are self-insured to commit to offering reimbursement for healthcare providers for 4 follow-up visits with a PCP a year and 4 visits with a registered dietitian a year to discuss health-related issues. And this is for children who are at the 85th percentile of BMI without the requirement of a comorbidity. So what that does is really shift the focus to prevention and get children who otherwise would be considered healthy but may be at risk of developing obesity into an early intervention to stop the upward trend of BMI. And we really thought that was critical, is to keep healthy kids healthy, and kids who are at risk, getting them the tools and resources they need, getting them into an early intervention to really start instilling these healthy habits. So we work with Emory University School of Public Health, and the first year they do the analysis. So they collect claims data every year from all of our signatories who participate. And the first year of the evaluation, which was done in 2011, they initially looked at barriers. One of the pushbacks I get when I go out there and talk to potential signatories is, oh, we could never implement this. This is too complicated. This will never work. Well, what we found in our initial signatories is that there weren't any barriers, that it actually was quite simple to implement as an employer, as an insurer. We also found that most others have expanded this benefit. So while they might have been offering a similar benefit, or maybe they didn't package it as the Healthier Generation Benefit, they were offering similar services, but healthcare providers just were not aware of that. We also found some changes in benefits around a signatory dropping a disease management program. Initially, one of our signatories thought, oh, well, we'll have them enroll in a disease management program and that will help us be able to track who's participating. But what they found is that actually was a barrier. People did not want to enroll in programs. They just wanted the benefit offered to them. Another insurer actually eliminated the deductible and coinsurance to increase participation. So then we have an evaluation meeting every year, and this year we looked at the data from 2012, and what we found are some best practices among our signatories. So provider incentives was a huge we saw a huge increase in diagnosis codes. So these are specific codes that we look for in the claims data. We also saw that active provider education strategies worked. Again, reducing copays is key. And then a development of an accessible RD network. We really feel that RDs are a valuable part of this program, and that we work with the American Academy of Pediatrics and the Academy of Nutrition and Dietetics. They are our partners in this program, and when we work with a lot of the pediatricians and we talk to them, they tell us firsthand, look, we don't know always what we're doing when it comes to weight management and delivery of weight management care. If we knew that we had an RD in our network and that we could easily send our patients there, we would do that. It's a weight lifted off our shoulders. And we find that and hear that time and time again with pediatricians. So not to get too much into the data, but I'll just show you quickly what we found. So we look again at very specific diagnosis codes. And while it's still low and it's not at the rate of what we know the state prevalence of childhood obesity is, we are seeing an increase of diagnosis codes. So again, we still have a work in progress. This is still considered in its pilot stage, but we are slowly seeing an increase among most signatories. We also are seeing an increase in overweight or obese children that were actually identified as overweight or obese, whether that's at the well child visit or another visit. They had the increase of those children that actually saw a PCP after that for a follow-up visit have increased, which is important and key. We also saw changes in RD services by overweight or obese children. The signatory that you see that has the highest RD claims is a signatory who actively recruited RDs in their network. So I will tell you about the benefit, and these are our signatories. These are not all of our signatories. These are some of our signatories that are participating across the country. What I will tell you is that with the Affordable Care Act coming and a lot of focus now in patient-centered medical homes and accountable care organizations, that there's a lot of exciting stuff being done around outcomes work, and we are in the process of revising the Healthier Generation benefit to focus more on outcomes and work with our insurers around integrated care delivery models. And we're looking to roll that out next year, so we're really excited about that. And then finally, as I mentioned, our supporting organizations are Emory, the Academy of Nutrition Dietetics, and American Academy of Pediatrics. We work extremely closely with them. We actually are rolling out a quality improvement project with the AAP next year that will be looking at identifying MD and RD teams to look at change practice and really get them to effectively work together and how we can help support their practice and that effort. I'm also presenting, if there's any pediatricians here, I'll be at the AAP conference in Orlando next month, so please come see me. I'll be there on Friday presenting as well as Monday. And then as I mentioned, Emory University does our third-party evaluation. Again, the Alliance is very focused on data collection, and we really want to make sure that our programs really have a positive impact on families and children. So just briefly, our corporate and celebrity partnerships. So again, thinking outside the box, where I said that we always have a seat at the table for everybody. You know, we again are 120 people. That's not a very big organization, considering that we're nationwide. So what do? We look to outside resources to really increase our awareness and really help our cause. So some of our recent partnerships over the past couple of years are on the screen. Some of these are cause marketing efforts. Some of these are fundraising marketing efforts. We will work with almost any company, again, to raise awareness of childhood obesity prevention. One of the examples is the Weight Watchers. There's 300,000 people that participated. Weight Watchers encouraged people to walk more last year. And this is a great opportunity to really talk about the Alliance and, talk about childhood obesity prevention. Another example is Brita. Brita donated 30,000 water bottles for us to distribute to our schools who are participating in our Healthy Schools program. This encouraged healthy drinking. And, what I didn't know until I was at the Alliance is a lot of public schools don't even have access to water fountains because of the lead issues in a lot of the older schools. So some of these kids go through all day without having any access to water. So this is a huge issue that we really need to address. So we've partnered with Brita to really increase access for these schools so that these kids can put water in water bottles and drink water throughout the day. So they don't have to go and get soda or diet soda. A more recent campaign that we're doing is with Jawbone, which is a company out in San Francisco. I'm actually wearing one of the Jawbone upbands now, and this tracks your physical activity and your sleep. Jawbone graciously had created a band in our color to raise awareness for the Alliance. So look for that in the stores in the next coming months. Some of our celebrity support, we work with Jillian Michaels. She has done some videos for us for schools to be able to show their kids and their staff members. We also work with Tara Stiles, who is Deepak Chopra's personal yogi. And she's also created some simple videos, I think they're less than 10 minutes, that schools can download and show their kids, as well as staff members can participate in yoga. And then Lorena Garcia is a celebrity chef. She was just on one of the cooking channels, the cooking channel on a show, Top Chef, and was raising money and awareness for us. She also has created recipes for schools, as did Rachel Ray. So for our participating schools, they can download these recipes that, again, meet our guidelines and are really fun. And they have fun names like Taco Crunch and all these great, cute names for kids. I'm going to show a video right now of one of our other celebrity spokespeople. For those of you who have tweens and teens, you may recognize him. I have a baby. I didn't know who he was till he started working at the Alliance or partnering with the Alliance, but the kids love him, and we use him a lot when we go out and talk to the youth.
Alexander. I'm an actor, and right now I'm working on a great show on Nickelodeon called iCarly, and I'm so thrilled and honored to be able to say that I am involved with the Alliance for a Healthier Generation, a fantastic organization that was founded by the William J. Clinton Foundation and American Heart Association, and we share the goal of inspiring kids and their families across the country to make health a priority and to take it into their own hands, and especially to make it fun. Recently, I had the incredible opportunity to actually visit a great school in New York called PS2, and what was so exciting was I really got to interact with 300 students across 3 different grade levels, 4th, 5th, and 6th. And what was so exciting for me especially, what was really stirring, was to watch them walk along a bar of fruits and vegetables and pick up yellow watermelon or go for that whole grain bread. And they were really thrilled to do it. They were passionate, they were motivated, and I think that's because of the Alliance's influence, especially taking into consideration that the school has taken home a silver award from the Alliance to acknowledge the incredible changes it's made across the board. And then something else that was really important for me, I had the huge honor of taking part in a youth-hosted forum just a few months ago for the Alliance for a Healthier Generation in New York. And it was really great because there were so many students from the New York area representing a number of different organizations that had complemented the work that the Alliance did. And what was fantastic was we opened up a dialogue about an issue that was really important to them, taking your health into your own hands, making it a priority. We know just how essential that is, especially when you start at a young age and those healthy habits become a part of you, and that's what the goal is. That's the objective for us. You know, it's so critical for me because I come from a family history with diabetes and heart disease. As someone who was overweight and has been in that boat, who has that story to tell like so many other people, the opportunity to be able to get behind this cause, especially in tandem with an organization that has so much positive influence to share and is sharing every single day on a number of different levels, that's what I'm really thankful for.
So finally, in closing, I thought I would leave you with this. Our Youth Advisory Board is a board of 21 amazing, ambitious, passionate youth who really want to make a difference in their communities and in their schools. And every year we accept applications for youth who are interested in becoming part of our board. This is a 3-year position. Every youth board member has to do a service learning project, however big or small it is. But this is the reason why I'm here today, and this is the reason why we're all here today, is for them. And we don't want to let them down. And I want to just end with a video from Mateo, who's a teenager. He's on his 2nd year on the Youth Advisory Board and he was asked, why participate? Why is this important to you? So with that,
it makes me feel better if I'm healthy, if I'm active, if I'm just sitting around on the couch watching TV. Doesn't make me feel good. Young people, we're the future of this world, and what we make of this world, if we're healthy, if we're not healthy, if we're healthy, that can make an impact on when we grow older, that can make an impact on our children and the next generations. But if we're not so healthy, then we kind of want to stay unhealthy, and then our generations after generations might not be so healthy. So I think it's important to start at the base.
with that, I'll take any questions.
Comment on I used to have a struggle with, especially for girls, body image and this whole thing of wanting to look like a Barbie and that whole thing. And I think it's just a difficult conversation to have, and you seem to be involved with youth so much. I wonder how you're approaching that.
That's a great question, and I don't know if we've actually approached out to our youth advisory board yet, or in some of the talks we've had and the forums we had with youth, but that definitely is an important issue that we need to address as a society, because we're seeing girls struggle with that image, that body image, and we want to make sure, and our organization really focuses on creating a healthy body image and a healthy weight, whatever that is for that individual. And really, especially with Youth Advisory Board member and our forums that we host for youth, is not so much focusing on the weight itself, but the healthy habits, and that's really what we want to focus on.
Hi.
Hi.
So my question is, do you guys have anything related directly to youth or children that have severe disabilities? I work in an approved private school, and we have several of our children and teenagers, especially in my classroom, that are very, very overweight and obese. And it's even harder for their parents and us to target them because of, the picky eaters we have, as well as the behavioral concerns. And I would love to do something to help our school as a whole, but I just wondered if you offered anything or have any ideas for that.
Yeah, we don't offer anything specifically for disabled children. I can connect you to someone in the Healthy Schools program to see if there's some parts of our framework or some programs that we have as part of the Healthy Schools program that may be helpful for your population. But we don't specifically focus on that.
Hi, Jenny.
Hi, Phil.
Nice talk. I just wanted to make sure, because we have such a broad representation of different sectors, how can they get involved with the Alliance or use your tools? Because I know you have quite a few online tools.
Thank you, Phil. Anybody can go to our website. All of our tools are free of charge. Some of our tools are only offered to those who do sign up to our programs. So if you're looking to participate in the Healthy Schools program, you can go to our website, register, and tell them your interest. Same with the Healthier Generation benefit. Especially around the benefit, we have a lot of provider tools and resources that we do with the AAP and the Academy that is just for our signatories. We also do offer webinars that are for any healthcare provider and they can get CME credits for and CPE credits. That's on our website for anybody to download and watch. But you're right, Phil, we have a ton of different tools and resources on our website, and I encourage you to go out there. If you have any specific questions or follow-up that you have for me, my number is in the brochure and the agenda packet. I will say, even though it's an East Coast phone number, I live in California, so while I would be very happy to talk to you at 5:30 in the morning, I don't start till 8 a.m. Pacific time. All right, well, thank you very much. Yep, sorry.
Could you please elaborate on what you termed the healthcare delivery model that you'll be rolling out next year around health systems who are attempting to navigate our providers dropping charges and billing for their services?
Yeah, so I can't elaborate that much on it because it's still a work in process. We're working with Emory University and some healthcare consultants around that. But again, our focus is going to be more on outcomes related, not so necessarily on claims data. And we're looking at HEDIS reports, but as well as accountable care organization and patient-centered medical homes, where a lot of insurers are focusing in on now and investing in, and doing away with a prescriptive model of 4 and 4, but allowing them to open up and say, look, how many visits do you want? It's up to you. We just want to see the outcomes of lower BMI down the road. So we're still kind of figuring that out, and again, working with our consultants, but we're hoping to share that publicly the beginning of next year. Yep. Hi.
Thanks for the great presentation. How do we support parents in this? Because it's a lot of, because I see that a lot of parents do want to eat healthy.
Yes.
But when you come back, overworked parents, when you come in with your laptops and your iPad and drag it in, it's very difficult to cook healthy dinner every day. How do you teach them that you can spend 3 or 4 days in the month to cook healthy, freeze it, there will always be healthy food in the house. The kids can microwave. So I think there should be a parent component to all these to really help parents, because it's really hard to come back in the evening and cook healthy every day because we're so tired.
Yes, I'm a new mom, I know. Yes. And that's a great point. And our website is actually geared towards parents. That's who our main demographic is. While we don't have recipes per se, if you look in your packets, we actually partner with the Michael and Susan Dell Foundation and created a Year of Living Well book. And that book and that DVD that you have in your bags are families that we've interviewed around the country of all different socioeconomic levels. And we've asked them, what are the simple things that you do as a mom, as a dad, as a guardian to help your family live a healthier life. So that's just one example. And these books, by the way, are completely free. You can go to our website and order as many as you want, up to 10,000, free shipping, seriously, and free shipping and handling as well. So if you have an audience yourselves that you want to get the message out, feel free to order those books. Those are completely free. And the books are also in Spanish as well. Okay, thank you, everybody.